morning, Judy. Good morning, Tinker. We are live in San Antonio, Texas with Dr. Phillips. Today, the first case is a lipo 360. She's also doing lipo to her arms. She's doing a BBL and a scar revision. Dr. Phillips, is this her second round of it, right? This is her second round doing lipo and BBL, so sometimes it takes a couple of rounds to get the exact look and you desire, but she's getting it done. She's gonna look amazing. If you guys have questions, feel free to ask. And if you have any questions about our pricing or promotions, financing options, or booking a consultation, you can fill out the form I just pinned to the screen. Or if it's ever gone, you click in the bottom left corner on TikTok. We are also showing this on YouTube. If you guys want to head over to our YouTube channel, you go to the link in our bio, or you can go to YouTube and search at Dr. Jeneby Plastic Surgery, and you can find us doing this live, where you can see the actual surgery happening. Hi Kayla, hi X, Ricardo, good morning. Hi Abdul, how are you? Yes, of course. Thank you for joining and watching. We appreciate it. Hi, Mimi. Fit Dad, good morning. Good morning, Crystal. Good morning. We're live in San Antonio, Texas right now. We're doing the first case of the day is a second round of lipo 360, also lipo to her arms, a BBL, and a scar revision. So she came in once for lipo and BBL, and she's getting some more work done. If you guys have any questions, feel free to drop them in here. We are happy to answer any questions you have. Good morning, Dee. Thank you for the follow, Patricia. Cinderella, good morning. Thank you for the follow, Unknown Artist. Guys, we are doing our first case of the day, lipo 360, also lipo to her arms, a BBL, so a Brazilian butt lift, and a scar revision today with Dr. Phillips here in San Antonio. If you guys have any questions about surgery, whether it's surgeries you're interested in having, or preoperative care, what to prepare for when you want to get surgery, etc., please feel free to ask. We'd like to take this opportunity to answer questions for anyone watching. And if you're interested in watching the surgery itself, you can always head to our YouTube channel through the link in our bio, or you can go to YouTube and search at Dr. Jeneby Plastic Surgery, where you can see Dr. Phillips operating live. Desi, Anna, good morning. We do have some specials going on for the month of November. Some lipo specials. We have some a turkey neck, no turkey neck special. We're doing some facelifts, and we're doing CO2 resurfacing. And we have 20% off our post-operative care products. If you're interested in any of those, and we all have tons of financing options as well, please feel free to fill out the form that's pinned to the screen. or in the bottom left corner, you can always click there as well to fill it out, and our team members can text you or call you, whatever's easiest for you. DJK, did you have one done, or you're interested in having one done? Did you do this patient before? Interested in having one. Okay, if you want to send us a message, or if you want to click in the bottom left corner, you can fill out that form. If you'll tell me your name, I'll let the team know that you're interested and see what specials we have for you that we're offering. We do offer some additional specials for our live viewers while you fill it out during the live. So if you fill that out, I'll pass it over to them, and then they can text you or call you to talk to you about pricing and financing options for that procedure. Good morning, Trendy Treasure, Melissa, Elizabeth, thank you guys for joining. Yes, no problem. DJK, what's your name, just so I know which one to look for, so I can pass it on to them. I'll let them know you came from the live. Or I see it's Dolores, right? Okay, I will let them know. Bernice, Pam, good morning. Thank you guys for joining. If you guys have any questions, feel free to ask. We are happy to help, whether it's how to prepare for surgery or questions you want to know about different procedures we do, etc. Please feel free to ask. We like to take this time to answer those questions for you. Again, we are showing this on YouTube. I know a lot of you like to watch the surgery itself, so if you want to go to our YouTube channel and the link in our bio, you can watch the surgery. This patient did consent to YouTube as well. Ali girl, thank you for the follow. Minnesota folk, too close to home, 4 weeks before. Oh well, I'm glad you had a successful surgery. I'm assuming. Scary. Open heart surgery. Thank you for the follow, Jamie. Jay Green, good morning. SNK, good morning. Becky Jean, good morning. Got a lot of people active today. Indeed, double bypass. Wow. Well, I'm glad that you're with us. I knew what you meant. Thank you for the follow. Yeah, I'm glad that you're recovering. That's scary. It takes a lot of courage too, but I'm glad that you're recovering well. Where's everyone joining us from today? Good morning, Camila. Right now, guys, for anyone who's not on our YouTube channel, we're doing lipo. So the first case today is lipo 360, also lipo to her arms. She's doing a Brazilian butt lift and revision to her scar. This is her second round. of plastic surgery with us, with Dr. Phillips. Right now, if you're not watching on YouTube, we are doing the lipo portion of her procedure on the front. So lipo 360 is always going to be the front, lipo on the front, lipo on the back. So we're doing the front right now. We will be doing her arms and then flipping her and doing the back and putting that fat into her butt for the BBL to give her that nice rounded shape she's looking for. Assuming we're also doing the scar revision while we do the lipo too, it's on the front. Looks like she probably had a tummy tuck before, Doc. So taking that and helping with that scar, making it less noticeable. So when they do C-sections, it's the same area but much smaller, right? C-sections? Hi Deborah, Angie, good morning. Sydney, thank you guys for joining. Cindy, Jen, Amanda, got a lot of active people in here this morning. Thank you for joining, guys. Please feel free to drop in the comments where you guys are from, any questions you have, if you've had plastic surgery, if you want plastic surgery. We'd love to chat with you. So Loving Life 7878. So the consultations are, if you go through the link in our bio or you fill out the form while we're on the live, they're actually $250 off. So they're $300, Dr. Phillips. I think they're $300. So that would be $50 with the discount. And if you fill out the form, you'll do that, and everything goes towards the cost of the surgery. If you fill out the form while you're on the live, and let me see if it shows your name. Okay, Loving Life, if you want to tell me your name, what I'll do is tell the sales team so that they can help you with booking a consultation and give you a special discount for filling it while on the live. Christina. Okay, great. Christina, let me pin this form. If you want to fill that one out, I'll pass it to the sales team and I'll let them know so they can give you the promotion for that. Are you here in San Antonio? Oh, from Colorado. Okay, beautiful. Love Colorado. I saw it snowing there already in a lot of parts. I don't know, Sydney. I'm not sure what to tell you. It's the lipo machine. I can't mute it because then I can't answer your questions. It's the. Oh, I thought because it looked like it said we hate the noise the way it was written. No, it's so yeah. It's the if you go to our YouTube, you can actually see it happening. But it's the lipo machine. Sucking out all the fat. Right. Awesome. Okay. Christina, I will let the sales team know. Norda, we are doing lipo 360. We're also doing lipo to her arms. We're doing a Brazilian butt lift. We're doing BBL and a scar revision. It's her second round of surgery, so we're doing lipo in the front, lipo to the back. She's doing her BBL, taking that fat and making her booty nice and round, and then the scar revision from her tummy tuck before. First lady wise wants to know, if considering surgery, how do we correct low hemoglobin?
Iron infusion.
Iron increase, did I say? Iron infusion? Iron infusion. First lady wise, iron infusion. Shan Marie, thank you for the follow. Also, I see your jumper. I have a horse as well.
What's shaking, babe?
The prima donna, good morning.
Get it.
Christina, I let them know about your form.
I have my bundle of energy.
Is that given prior to surgery? Yeah. Dr. Phillips, is the iron infusion something that we can help her with prior to surgery? Yes.
If she's local.
If you're low, yeah. Oh, if you're local, yes. Are you in San Antonio? Good morning, Dr. Martin. Good morning, Courtney.
Dr. Martin! What's Scott?
It is, I don't know. I don't think he's on here anymore. I don't see him now. With low hemoglobin, am I a good candidate for BBL and tummy tuck? As long as she gets that infusion.
Yeah, we like the hemoglobin around 12.
Hemoglobin is preferred around 12. Do you know what you're at right now, first lady wise? Good morning, guys. Thanks for joining, Lori, Mickey. She's at 10. She's at 10 right now.
Yeah, so usually 2 or 3 iron infusions.
2 or 3 iron infusions, and you should be a
I'll
good candidate.
recommend 200, and there's going to be more later.
Are you here in San Antonio, first lady wise? I can have one of our team members, if you want to fill out this form, I'll have them talk to you and see if where you're at, and like kind of give you a little more information on it. You're in Georgia, okay. Can diabetics do tummy tucks?
Yeah, hemoglobin A1C less than 7.
Hemoglobin A1C less than 7? At least less than 7. Thanks for the questions, guys. We love being able to answer these for you and help. Okay, absolutely. Did you fill out the form? So they're able to contact you? And Norda, just for peace of mind too, we always run the appropriate tests beforehand to check all your blood work and make sure you're a good, healthy candidate for surgery. That goes for both First Lady Wise and Norda. We're very big on obviously making sure the patient's healthy before putting them under any sort of intense, plastic surgery, under anesthesia. We also have our anesthesiologist monitoring the entire time through surgery to make sure everything's good. So we do take your health and caring for you, it's an absolute #1 priority for us.
$200 lower abdomen, and there's going to be more for that. You can start closing that center. Vaser is going to be 1.5 minutes to each area.
Because you said which surgery were you BBL on tummy tuck. Okay. Let me see. So she's asking if she does both procedures, a BBL and a tummy tuck, how would she sleep?
Sorry.
On your side. With BBL, you will be given a special pillow to sit on, but typically you'll sit on your side. I will say, I've only had a breast augmentation done, but even then when you sit up, you have to sleep sitting up. It's a little bit of a process, but you know it's worth it because you love the confidence it gives you, love your new body, so it's temporary. Beauty is pain, and pain and temporary discomfort. But I would recommend if you're able to do both at the same time, it's going to save you money. And
Well, yeah, with our tummy tricks we do lipo. So.
And with the tummy tucks you do the lipo.
BBLs.
And the BBLs.
You're not gonna have as much fat.
Right. Oh, true. Yeah. So doing the tummy tuck too, you're gonna have more fat to put into your booty. What happens if there's an emergency? What happens if there's an emergency since the doctor is a plastic surgeon?
Oh, yeah, man. We're still documenting emergency room. I mean, we're a mile away from a hospital.
Yeah, probably less than that. We're about less than a mile away from a hospital, but we also have our anesthesiologist here in case of emergency. But what kind of he would like to know, Dr. Fernandez, when I know what kind of emergency, so he can be specific on his answer.
Prevention is probably our main goal. That we don't get any emergency.
There you go. So that's a good point. Our anesthesiologist was saying that we do a lot of preventatives here, like we're monitoring the whole time. There's fluids going, everything's being monitored, so we do make sure that the chances of an emergency happening are very low.
We take the history, look at
History screening, yeah.
look at your medical history.
We do blood work beforehand.
Blood work.
We do tests same day to make sure you're not doing anything sneaky like smoking and all that. But if there are emergencies, what kind are you speaking of specifically? We can address that, or oh wait, what was that? There's some other questions in here too. Shortcake Christina, low blood pressure. Shortcake Christina, only part of your question came in. It says low blood pressure. Are you asking what to do if you have low blood pressure for surgery, or what was the question for that? Susan, Larry, thank you for the likes. But our plastic surgeons know a lot more than I feel you're thinking for.
Not just pretty faces.
Right. Dr. Phillips, for example, was in general surgery for 4 years? 5 years prior to plastic surgery.
I did internal medicine prior to anesthesia too.
Dr. Hernandez did internal medicine prior to anesthesia. So a lot of them have experience in multiple areas, and they all go to the same medical schools and then decide specialties after that.
Where'd you do your medical, Randall?
You can just,
Oh, okay. I remember that one. That's where I was. That's where I was. Let's just get out of that corner. I think for airplane back, she may not be able to see very well.
All right, let's see. Shortcake Christina, I have POTS, so blood pressure drops sometimes. Will they still do surgery with the is it POTS or is it POTS surgery for patient? POTS, it says?
what is that?
Shortcake Christina, what is it an acronym for? She had said her blood pressure drops sometimes, so I'm not sure if that helps, but.
Well, that's something that would have to be addressed and evaluated at another time. That's beyond our scope. We don't like to treat things like that once we're in the OR. We like to have it evaluated ahead of time.
Okay.
To see if whether they're anemic, if they're taking medications incorrectly, that kind of situation.
That's like a cardiology clearance.
So, yeah, so again, like Dr. Hernandez said before, we try to do all the preventatives beforehand so we're not worrying about it when you're under and in the OR. But if you can answer what it stands for, I can give you a little more information. But we try to make sure like you're taking your medicine correctly, like different factors that might be affecting your health are taken care of prior, whether it's with your cardiologist or whoever, before coming to get plastic surgery. Which is better for weight loss patients, fleur de lis or tummy tuck?
Depends on the
Depends on your anatomy, what it looks like. That's why consultations are always great. And First Lady wise, since you are in Georgia, we do have virtual consultations as well. So I'm sure our team will talk to you about that since you filled out the form, but we do have virtual consultations, so you're able to show through a HIPAA compliant program. So we have, we can do an evaluation there to determine what would be best for you. Betty Jackson, thank you for the follow. Consultations are not free. However, the price of the consultation does go towards your surgery costs. So whatever you pay for your consultation, that amount goes towards the cost of the surgery. However, we do have specials for our live viewers. If you fill out the form that I just pinned to the screen while we're on the live, Crystal, you can get $250 off your consultation, which I believe brings it down to $50 for the fee, and that will go towards your surgery. Yeah, a lot of people opt to do the virtual consultation. We do have a ton of people from out of town, whether they're out of town, out of state. We do have people that come and see us from different areas. But virtual consultation is nice. Damn it, Janet. Thank you for the follow. That's her name. Love it. Good morning, Heather. Good morning, Betsy. Paula Ann, thank you for joining. Oops. Forgot about my YouTube, guys. Mama B, thank you for joining. Jamie Lynn, thank you. Good morning, good morning. For everyone new joining us, we're live in San Antonio, Texas with Dr. Phillips. This is Dr. Phillips' first case of the day, and we are doing, this is his first case of the day, but second surgery with this patient. She did a third surgery with this patient. She has done a tummy tuck, looks like a breast augmentation with him, and some lipo. Did she do a BBL before also?
Yeah.
Okay, so she did lipo and BBL before, and today she's doing another round of lipo 360. So lipo on the front, lipo on the back. She's also doing some liposuction to her arms, and then we'll flip her over and we'll do lipo on the back and take that fat and put it into her booty. And we're also working on a scar revision from her tummy tuck, trying to make that scar less noticeable. She's looking great, and we are showing this on YouTube. If you guys want to watch the surgery happening live, you can go to our YouTube channel, which is in the link in our bio, or you can go to YouTube and search at Dr. Jeneby Plastic Surgery and see the surgery happening. Watch Dr. Phillips doing his magic here. And as always, we have the form in the bottom left corner if you're interested in booking a consultation or learning more about our pricing and financing options. We have in-house financing, third-party lenders, we have cash discounts, we have a ton of options for you guys to get financed and get the payment plan going for your dream body. I'm unmuting. I was like, look at Phillips. Nair Miami Plastic Surgery.
Here!
Good morning.
Oh, Pepe!
Norda, thank you for the follow. Zach, so my job is actually to do social media and film the lives and to answer questions while they're doing surgery. So that's why I'm streaming, because that's my job.
See now?
Melissa, thank you for the follow. Addie, thank you for the follow. Crystal, okay, I have been wanting surgery, but I want to wait 1 more year before I do it. Okay, yeah, well, if you want, we also have like layaway plans. If you want to start making little payments here and there, you know, each month to prepare for the cost.
Prices are only going to go up.
Prices are only going up.
You
So,
can lock in your price now.
and if you want to fill out that form, what I can do is I'll tell the team you came from the live, and they offer more discounts for coming from the live as well. I love when the people are like, why are you streaming when you're at work? I'm like, because this is my job. I get asked all the time, why aren't you working? Like, this is my job. For any of you who are interested in watching the surgery and are just joining us, we are showing this on YouTube where you can see the surgery happening versus just my face. TikTok, Instagram, Facebook limit us on what we can show. We can't show blood. We can't show anything graphic. But YouTube allows us to filter out our audience. So you can go to our YouTube channel and watch the surgery happening. This one's not so graphic, but just if you have a weak stomach, you know. It's nothing's open in this one. Do you do any reconstructive work, or is it all cosmetic? All cosmetic work. Dealing with insurance is not something that we do very, 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 very rarely, less than 1% of the time. Tracy Hunt, Green Eyes, thank you for the follow. Oh, okay. So Jose was being sneaky. He asked about reconstructive work because he's a locums recruiter. So we get a lot of locums. That's why. Thank you, Tracy. Thank you. When is clearance for surgery done?
What?
When is clearance for surgery done?
If we determine it, we give you all the paperwork that needs to be done. Ideally before, at least a week before surgery.
About a week before surgery, ideally. And then that morning, when you come in for surgery, we do run a couple more just urine tests, things like that, but everything else is done about a week before. Christie's 3D prints. Have you heard of the pet facelift? No, I haven't. Tracy, today we're doing, the first case is a lipo 360. So she's doing lipo on the front, lipo on the back. She's doing a little bit of lipo to her arms as well. We're doing a BBL, so putting the fat and putting it into her, that we took out and putting it into her butt to give it a nice round shape. And then we're going to do a scar revision for her. She had a tummy tuck previously with us, and there's a little bit of scarring still, so we're going to try to make that a little less noticeable. It looks really good right now, but she's wanted to see if we can do anything more about it.
The scar bothered me more than I go with her.
Yeah. Nadine, yeah, that's why I always give a little bit of a warning, like, okay, you know, if you can do it. This one's actually pretty, it's not, we have some where we do the tummy tucks where they're like wide open, so like the skin is wide open. So about 6 weeks, Crystal. Going back to work a couple weeks after, but 6 weeks probably for full,
Yeah, just
I'd
for
say.
a second.
4 to 6 weeks. Pet facelift. So what is it like? Are you talking about threads, Christy? Is that what you're speaking about? How long after I give birth can I get a mommy makeover?
So, done breastfeeding 3 months, but you want to be at least 6 months out from pregnancy.
6 months would be the ideal time. 3 months after breastfeeding.
If you're still losing weight, your skin's going to tighten up some.
Breastfeeding helps with that weight loss too, and then we also have skinny shots can help with the weight loss prior. You probably can't do skinny shots at the same time as you breastfeed though, right?
Huh?
You probably can't do skinny shots at the same time as you do breastfeeding.
I don't know.
I'm not sure about that. I would, yeah.
recommend it. You need all those calories.
Mhm.
Another 100 upper abdomen.
Yeah, Tracy, she's gonna look. She already looks really good. She's done some surgery with us with Dr. Phillips prior. She did tummy tuck, lipo. She did breast augmentation, BBL. So she's doing another her third surgery with Dr. Phillips. Another round here to get more fat, bigger booty, scar taken away more, etc. Basically, Micah. So it's the same active ingredients. We just call it the skinny shot. But it's not the same brand. So kind of like Botox is a neurotoxin, but Botox is the most popular brand, and then there's,
Like a Xerox machine.
yeah, exactly, like a copy machine,
Everybody calls
Xerox
it a
separate,
Xerox
or a
machine.
Ziploc bag, same thing. So basically, but yes,
Same product, different.
same active ingredients, though, right?
For what?
For she's asking if skinny shots Ozempic.
I'm not sure. There's some that work twofold, like the GLP, and there's something else. I don't get involved in all that.
Norda, I saw your message on YouTube. Yeah, sometimes it's a little bit graphic, but this one's actually not as graphic as they can be. So, are size C gummy implants heavy? So, it goes by cc's on the implants.
Do you have a chair?
Speaking from personal experience, I don't think so. It was about 11 years ago, so I don't really quite remember, but I don't remember feeling that wasn't one of the concerns I had, was that they're heavy. It's probably less heavy than actual fat. Gummy implants are probably less heavy than actual fat, right? We are in Texas. We're in San Antonio, Texas. Where are you at, Tracy? Nicole, thank you for the follow. You guys, I pinned to the screen again our form, or the pin I put on there. You can fill out the form to book a consultation. We have virtual consultations, in-person consultations. You can also ask about our pricings and promotions. We do offer a lot of price cuts for our live viewers when they fill it out on the live. And we can answer any questions about financing you have, etc. Barb Nuremberg says, "Hi, Dr. Bam, miss you guys." He says, "Hey, how's your recovery?" He wants to know. Tracy, Las Vegas, nice. I was out there 2 months ago. 2 months ago. I'll be out there again in May. Mark, Clarissa, hello. She says she's getting all of her surgery redone on the 14th. They messed. Yeah, she said he messed up. Oh.
Stay patient.
Stay patient. He said it happens sometimes. Well, never mind. I'm not gonna ask that. I was gonna say who did she go with, but
She's
out of the country. Okay. I hope you have a speedy recovery. That's no fun. Oh, she's in Michigan.
I guess I just assumed because she said Nuremberg.
Oh. Oh, nice. Are you in the actual city itself? Or are you right on the outskirts, or are you out in Vegas? I always have a fun time when I'm in Vegas. It's hard to not have a fun time. Unless you're losing a lot of money, which does happen, so then I have a less fun time. Thank you for the follow, Rivrod. Silverback, thank you for joining. Guys, we are live here in San Antonio, Texas. You're in Vegas, nice. It's so pretty. I actually drove out there when I went 2 months ago, and I had never taken that drive. I've been driven to El Paso, but I've never been beyond that driving. And it was so pretty to go through Arizona like that, New Mexico. It was like just incredible to see all the different views. Drove past the Grand Canyon, etc. Tracy, thanks for joining. We are doing lipo 360 for our first case, which is going to be liposuction to the front of her body, liposuction to the back. She's also doing some lipo on her arms. She's doing a Brazilian butt lift, so taking all the fat we're taking out and putting it into her butt to give her that nice rounded shape that she's looking for. And we're doing a revision on her scar that she had previously from a tummy tuck. Nor to the tummy tuck. So she's not doing tummy tuck this time. She's just doing lipo this time. She did tummy tuck previously. But yes, with all our tummy tucks, we do lipo. Yes, very much so. All the mountains everywhere, everything. It's your girl. Thank you for the follow. Arthur Solis, thank you for joining us. Thank you for the follow, Angela. Renee, thank you for the follow. Barb said, on a good note, I've lost 27 pounds, changed my food habit, no more candy or chips. I'm lifting now too.
Awesome.
Good, that's awesome. You probably feel better too. Congratulations on that. That's awesome. It's hard to break some of those habits, so good for you. Yeah, good. I'm glad. Of course. Katie Sunshine Goddard, thank you for the follow. Guys, we're live in San Antonio, Texas with Dr. Phillips. He is doing Lipo 360, BBL, and scar revision today, and I am here to answer questions you guys have about plastic surgery, preparing for plastic surgery, different types, asking about different procedures we do, health questions about that, any questions about pricing, promotions, and booking a consultation. You can fill out this form. If you fill it out while you're on the live, you do get an extra discount on top of what we're offering right now. We also have some specials going on for November. Liposuction specials. We have no turkey neck specials where we're doing a facelift, neck lift, and CO2 resurfacing specials. 20% off our post-op care products, etc. And we do have a ton of financing options right now too. Diane, thank you for joining. Beverly, thank you for joining. What does this do? Just to check the temperature? Nice. Awesome doctor and perfect work. Arthur says, awesome doctor and perfect work. He said, how much did I pay you to say that? I think so too. I agree, Arthur. He is definitely amazing. Everyone loves him. He has great bedside manner. He's wonderful to his patients and does great work. He's kind of nice, you know. We all give him a hard time here. Thank you for the follow, Teresa. It seems like they give Dr. Ayala a harder time than you, though. You don't keep him here till 9 p.m.? He does good work too, though. Perfectionist. Good morning, Teresa. Thank you for your follow. Guys, just a reminder, we are showing this on YouTube, so if you're interested in watching the surgery happening and watching Dr. Phillips live here, you can go to our YouTube channel, the link in our bio, or you can go to YouTube and search at Dr. Jeneby Plastic Surgery, and you could see the surgery happening. We did the lipo on the front. We're working on tightening her up on our waist here. And then we're going to flip her over, do lipo on the back, and do her BBL. So if you guys want to watch it live, you absolutely can. This one has consented to YouTube, so we can show everything. TikTok, Facebook, Instagram only allow us to show certain things, so. I do see 2 people on YouTube right now, but I have seen as many as 12 before on here, so. I'm gonna go over here and lean on this wall. Arthur says he likes how his scars came out. You can barely even see them, if at all, very little. Amazing, we love to hear it. What did you have done, Arthur? Good morning, Beverly. Oh, he says not him, his wife's boobs. Good, I'm glad he's here. I'm glad you love his work. That's great.
I understand now.
Yes.
Yeah, Michael. Yes, too. Like, yeah.